Here at the Melanin Initiative, we simplify medical information into language you can understand. We create a safe space to ask your questions and share a nursing perspective. By the end of this episode, you'll rethink everything you thought you knew about burnout in healthcare. We're talking about real reasons people leave, and what it costs when leaders ignore compassion fatigue. Today's guest is a powerhouse in scrubs and stilettos, award-winning nurse anesthesiologist, certified life coach, speaker, and CEO of Intentional Queen Journey, Jineen Huff. She's walked the tightrope of healthcare leadership, hit burnout twice, and now leads a movement for wellness that's transforming corporate healthcare spaces. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast, and we have two missions. The first, to promote that health literacy, both amongst the public and our peers. The second, to elevate the expertise of nurses, to bring awareness to all the diverse career opportunities in the industry, and to let all of our peers know all the ways that they can leverage their expertise, both as clinicians and entrepreneurs. Janeen's going to help us check all those boxes today. If you haven't already, this is your chance to subscribe. Give us a thumbs up, leave a comment or two, share this information with your friends. Give us 5 stars on Apple and Spotify podcasts. When you interact with our platform like that, it lets the algorithm know that this information is valuable, so that when people like you look for topics like this, they'll show up higher in their search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741 741. Today, we're honored to welcome Jineen Huff, an award-winning nurse anesthesiologist, certified life coach, transformational speaker, and the CEO of Intentional Queen Journey. With more than 25 years of experience in critical care and trauma, Jineen intimately understands the mental, emotional, and physical demands faced by high-performing professionals in healthcare. She has personally experienced burnout twice during her clinical career, which led her to take a purposeful sabbatical focused on healing and reflection. From that journey, she launched a movement dedicated to empowering ambitious moms and women in healthcare, a mission that has since grown to include helping healthcare systems and corporate leaders implement sustainable strategies for wellness, retention, and resilience. Janeen's evidence-based Bloom framework, coupled with her lived experience, equips professionals and organizations alike to redefine success, emphasizing harmony, purpose, and longevity over exhaustion. We're so grateful to have her here to share her insights on compassion fatigue, emotional exhaustion, and practical tools to build resilience in demanding world of healthcare. Please join me in welcoming Jineen Huff to the Melanin Initiative. Hi, Jineen.
Hello, thank you so much for having me. It's different when you hear people read back your whole little bio. I'm like, that 25 years gets me every time when people say it. It lets me know she's not as young as she used to be anymore. But yes, thank you so much for having me. This is such a great topic and a conversation that I think is not really talked about as much. But I would definitely want to come here and give your audience the things that they need so that way they can too learn from the movement as I had to learn.
Yeah, this is wonderful. We're going to do our little icebreaker before we get started,
Okay.
but let us know where you're joining us from. We can all hear your accent.
Yes, I am from up north. I'm right outside of the Philly, Pennsylvania area, and I've been up this way most of my life, but a lot of my family are down south in Georgia, so I do a little bit of both. But yes, I have that up north accent that people always tell me they hear.
And if you're listening to us on Apple or Spotify, make sure you come and watch us on YouTube, Facebook, or LinkedIn so you can see, even though she said she's been doing this for 25 years, she doesn't look like she's done anything for 25 years. She looks great.
Thank
So
you.
our icebreaker is 5 questions in 5 minutes. So don't overthink it. It's just an opportunity to have fun and for us to get to know you, a different side of you.
Okay.
So this first one is my favorite question. So what's the best thing that never happened to you? This is something you wanted, it didn't work out, and when you look back, it actually was a good thing.
Mm. Oh, this is so good. Something that oh, you know what? I wanted to have like a travel type of job, travel and just be able to do like both, like work and travel and be in those other locations. I think for me, doing everything I did, I kind of got settled and then I didn't really have that ability to do that because I've been doing nursing for so long.
And that ended up being a good thing that you didn't travel?
Part of it is because I guess what I would say with that is it's part of a good thing because if you are able to stay put, I was able to do all these different type of things, meet people and get grounded. But parts of me would have loved to travel, but if I didn't, I wouldn't be able to be here now and have all the experience that I have. So that's the positive of it. But yes, those are things when I was younger, like I said, and we'll talk more about it. I always wanted to be a nurse at the age of 4. So if you talk to me at 4, I was going to tell you I was going to be a nurse at 17. I knew what I wanted.
Okay, what's the next big thing you want to be a part of?
The next big thing I want to be a part of is this movement of jumping into corporations, hospitals, schools, and really just getting the word out about burnout and really what it means and things and lessons that I didn't learn until later in my career. I recently was on another nursing podcast with Dell, and she was like, I wish the younger nurses would know how to have resilience, how to deal with certain environments, because that's how you get to burnout. And so if I wish I had some of those tools, then it would have helped me. And I think it starts at when we're training our nurses or in the hospital setting where people know how to manage so you don't get to the point of exhaustion or you don't get to the point of compassion fatigue, because it's very common and a lot of times we ignore it and just keep pushing through and then you hit the wall like I did twice.
Mm. Okay, what's advice that you give others that you need to believe yourself?
Mm. The hardest thing that I had to do is believing in myself with the pivot. When you start to go into new spaces, sometimes we don't really trust ourselves in that new space. So for me, as you already said, I'm on a sabbatical. I've been out since October. So I made a choice to step away from doing nursing anesthesiology. I had got top nurse in my state. And so when I got that, I saw that as a graduation, but stepping into this space of being able to go out and speak and go ahead and step into other arenas that are new, but they need to hear me and believing that they could see that this is what they need. And I'm the girl for it.
Who would you like to give their flowers to?
Mm. You know what? It's funny, Mother's Day just happened, but to my mom, a lot of what I learned as a woman and a provider and all the things I've done, my mother. And I also to my son, because I believe in building legacy. And that's why it's so important that I talk about burnout, because it's a leadership type thing. And as women in general, we're leading homes as well. And you want to make sure you're showing up best for your kids. So that's why I said it's very integrated. And that's what harmony means. And we'll get deeper into that. But my child helped me become better. And so my mom is the previous generation and I'm the new. And so I see myself trying to break things and show new ways of how it could be when we learn how to not balance, but have harmony.
So excited. And the last one, this is my favorite one.
Okay.
What season are you in now?
I'm in a season of refinement. Every year I have a word of the year. And last year my word was expansion. And so I expanded my territory into so many different things and trying different things. And now it's refinement. So stepping away from the bedside, now I'm refining how this looks. How does the I Choose Me movement look? How can I serve people? How can I serve myself, right? Taking a sabbatical was for me, and that was a choice. And learning that I too matter and different stages of life can look different and be okay. I was an overachiever, a perfectionist. Like I need everything to be dotted of the I and cross of the T. And when you go into a space, like I said about believing in yourself, but uncertainty, that is a different way to function. But being okay and flowing in it and being like, this is what's happening and being okay with it.
I couldn't agree more. I'm super excited. We're going to jump into our case study,
Yes,
which is the St. James Medical System.
yes.
It's a large corporate hospital system known for expanding rapidly in urban and suburban markets. But behind their growth, their chief nursing officer has noticed a troubling trend: rising absenteeism, late shift callouts, increased employee relations cases, and private reports of suicidal ideation among middle management. They recently lost 3 experienced nurse leaders in a single quarter burnout. To burnout. One employee, Tamara, she's a 38-year-old Black mother of 2 and the ICU nurse manager. She left on short notice, citing emotional exhaustion and never feeling safe enough to admit she wasn't okay. So, Jineen, you lived this. What is compassion fatigue really, and why is it hitting high-achieving Black women in medicine so hard?
Mhm. You're so used to doing everything and being everything to everybody else that you neglect yourself. I have recently did a podcast where I was on somebody else's platform and they asked me, how did I neglect myself? Like people were very shocked. It's very easy to do and you miss it because you're so used to showing up for everybody else that you are pouring from an empty cup. And so that's how I got sick and almost had a stroke before the age of 40. That is how I started having thyroid issues and all types of things. Like I look different now, but when you see me in burnout, I didn't even notice. I just kept pouring. And in nurse anesthesia and doing trauma and leadership, like that takes a lot of out of you in itself. And then I still had to come home and be a wife and a mom and all the things. And I lost myself in that. So to me, compassion fatigue is you just keep going until you hit the brick wall till you have to sit down. And so when I went out the first time, that's when I was having health problems. And then the second time, that's when I went out and had the injury and I had to relearn how to use my whole left arm again. And I was out for a year. That's when I ended up writing the book.
Mm. Oh, wonderful. What are some signs that leadership overlooks until it's too late?
I feel like they're always putting on the high achiever and the high performer. I think I did a LinkedIn poll and I talked about rest. And I asked, do you know how to rest? And most of them thought that 60% of them was like, they feel like they don't have permission to do it or they feel guilty of it. And so I think for me, what leadership misses is not looking to see if they need rest. And if you're in leadership, sometimes you don't even want to show that you are lacking. You're just showing up and you're just unraveling behind the scenes because it is what you do in private, meaning like the silent battles that you're facing. Life is always lifing for all of us in some capacity, right? When we get health insurance or we get things, we always have that life event. They ask you, do you have a life event? Are you married? Are you getting divorced? Like I've had the marriage, I've had the divorce, I've lost the baby. Like these are all things that are life events, but silently you're carrying in it. But when you're in leadership, you have to still show up and perform, especially if you're taking care of patients, right? And in anesthesia itself, like it's life or death. I need to hit that marker every single time as close to 100, right? So that's like where perfection paralysis gets in. And then you get that savior complex, superwoman syndrome here to save everyone. And then you're lost, you're depleted. And I feel they don't see the resilience that needs to happen there. But are you checking in on your strong friends? So are you checking in on your strong workers? Is the work being diversified correctly? Are you taking your PTO? Because some people don't even feel comfortable taking their PTO. And I'm one of them who was guilty. So there is a lot to unpack there that I think will be deeper than just this episode. But I think for leadership, it is checking in and making sure that it's okay. And how is your team? Are we checking in with them often? Because sometimes you can look okay. And if we're being really clear and valid, look at a lot of the biggest actors or actresses that committed suicide. Most of them, when we saw them, they were smiling. Robin
And we were,
Williams, all of them, like you never would have thought. It's like, right? Because they learned how to put on a mask. And we wear our mask like a cape. Da-da-da-da. Right? And so people didn't know that my life was unraveling. That's how my book was written. And people really got to know what was going on behind the scenes. But when I was showing up to do nurse anesthesiology and I'm showing up to take care of you and doing all these things for 25 years, you would never know because I just learned how to compartmentalize and show up for the thing. But on the inside, I was having a lot of things going on into my health. Like then I sat down. I had no choice. Doctors was like, do you want to live? Your blood pressure is too high.
Welcome to Premier Endocrine and Wellness Clinic, a new way of endocrine care. My name is Dr. Peggy Amwakuhene. I'm a board-certified internist and endocrinologist. I am the founder and CEO of Premier Endocrine and Wellness Clinic, and I serve patients in Virginia, DC, Maryland, and beyond. So which conditions do I manage? Apart from the usual diabetes, which could be type 1 or type 2 or diabetes in pregnancy, I also deal with thyroid-related disorders, whether you have an underactive thyroid, overactive thyroid, you have thyroid nodules or even thyroid cancer. I treat those as well. The other things I deal with, PCOS, people who have bone-related issues like osteoporosis, adrenal-related issues like low cortisol or too much cortisol. These are things I specialize in. So why choose Premier Endocrine and Wellness Clinic? This is currently a virtual practice, so you can receive care from the comfort of your home. We're currently not a network with insurance, but rates are affordable and will not break the bank. There are no hidden fees and there are no membership fees. To make your appointment, follow the link below.
So So these are
Yeah.
valid conversations. Yes.
So when it comes to that high achiever, right, which a lot of nurses are, right?
Yes.
t-
Yes.
Um, that type A personality, right? So what you've demonstrated to your community is that you know how to get things done. You know how to get hard things done and a lot of hard things at once. And so they see you doing these achievements and they don't feel like they need to check in on you because everything's going so well,
Yes.
right? And so
Yes.
you're the last person anyone's checking on. And I relate to that personally. And yeah, we're not going to turn this into a therapy session, but yeah, and we'll have these conversations like me and you are having, and we'll say everyone and we'll fill in the blank. But people will be like, but you, we just said everyone, like everyone. That's me, that's you, that's all of us, right? And then especially in healthcare, because, and this is my little thing, uh, we're talking about patient-centered care, right? We pride ourselves on patient-centered care and working hard. There's a part of Americanism where working hard is like a badge of honor.
Yes.
And depending on your field, it's even you get a gold badge, right? Nursing, healthcare, law enforcement, um, there's probably some law, right? Even the, people who are making decisions and stuff like that. And the problem with that is that it's not true. It's not true, and it's not possible, right? This idea that you have to do everything on your own. You mentioned suffering in silence, working in silos. We do that, and our whole education is based on patient-centered care. But as a new provider, I realized really fast that I was getting lost, and so now I have a whole thing called provider-centered practice, and I think they can coexist, right? Because if I hold back just a little bit, and everyone on the team holds back just a little bit, but knows their roles and responsibilities and shows up and completes those tasks, the patient will still get the best care. They'll still get patient-centered care, but we will also have something left in the tank when we go home for ourselves, for our loved ones who just watched us for the last 25 years, go to school, take these exams, go back and get their certification, go back and get the licensure, go to this, go to that, do this, go through orientation, switch jobs, move into leadership. All those are transitions that take months sometimes to get through. And then you're bringing some of that work home. And they're like, well, when is it my turn? And you're like, but I have this, this is life or death I'm dealing with. You have to understand that it'll come later. Our time will come later. And so now I have this whole thing on provider-centered practice. Now you have something left in the tank. Maybe people will have less burnout. Maybe they will have more joy. Then, of course, I have time to schedule appointments for myself, go to my own doctor's appointment. And so that's my little thing.
I would say this because I had to learn to let go of all my titles and idols. Like I have a lot of receipts. It's a lot of, when you start reading, my letters behind my name are very long, but I had to learn who I was. Because even when I went out with my injury, there was discussion of, will I be able to do nurse anesthesiology again? So when you said, what space are you in? Like I had to decide, what does it look like for me? Because sometimes when we choose this career, we believe it's forever. And so then you don't know what the next thing looks like because you've done it for so long. But I think when we learn boundaries, because you said provider-centered care, to me that sounds like boundaries. We learn how not to give too much, but no boundaries are for you. And see, what happened for me is I ended up going to a therapist when I hit my first bout of burnout. And she said, I'm not vulnerable. And she said, maybe you should do a podcast. So my podcast became that space where I started to know it was HR leaders, it was nurses, it was therapists. So they became my coaching clients. That's how the book was done, because then I recognized, like, I'm not alone in this. Like, there is some people who are really struggling, and most of us don't have that safe space to ask because we are the safe space for everybody else. And so learning how to have enough, and I think, as you said, with me having a child, he watched me go through a lot, that he has learned what is so important in the power of enough, in the power of rest, and really the power of peace, and making those pockets of time. Like at work, I used to be the one like, no, don't worry about giving me a break. I'm good. I'll work through now. I'll be like, I'm going to take my break. Those are things, right? Over time. And I think this was the biggest thing you hit on that people don't fail to look at is you become what you're so used to. So in our job, we are so used to giving care. So you come last. So as nurse anesthesiology, I'm one-on-one with you in the operating room. I cannot leave my station to go anywhere because that's job abandonment or patient abandonment. So you end up bringing that home. It spills over into other areas of your life. And then you learn that it becomes everyone else before you, because you asked about compassion fatigue and how people get there. You're so used to giving because that's even what you do at work. So you think it's not going to spill out at home in those other areas, and they're getting the depleted version of you. And then you're like, well, what time is for me? And then you don't even know what you look like because you've done everything for everybody else. So then you lose yourself, right? So you got to find yourself because all these life transitions happen. And this is just a disclaimer of me saying this. Two things. One, with nurse anesthesiology, we have a high rate for suicide, high rate for drug abuse, high rate for divorces, and high rate for fertility issues or miscarriages. I had the miscarriage. I had the divorce. Thank God I did not do suicide, and thank God I'm not drug abuse. But I had 3 people I know that were personal providers that one either committed suicide or drug abuse that went bad. So when you think about your environment and the stress, coping mechanisms, right? So burnout can be even your coping. You could be an overachiever and overworker because that's your way to cope. And who did you see
Yes.
cope like that?
Yes, exactly. And so you brought up PTO, which because of this platform, I've had the opportunity to talk to so many therapists myself, and they brought up the fact that even though as an employer, I'm offering this benefit of, employee assistance, the employee assistance program, but then they're saying people don't use it because they don't want it being in their record. Now, that doesn't mean they're not getting therapy. It just means they're not using this great benefit that the organization is promoting. And so when we talk about our case study here, people confuse burnout with just needing a vacation, right? What's the deeper danger in that mindset?
The deeper danger is, your health and mental health. So just even the things I talk about in nurse anesthesiologists as a whole, right? So there's other factors. You start coping in other ways that are detrimental to your health and wealth. And mental health is wealth. So if you're mentally not sound or okay, nothing else will be good for you. So when people say, what is it? I mean, I really had to learn I'm replaceable. I think I used to function from that place of, if I do all of this, I'm valuable. If I push so hard, they're going to see it all. And, like that is the mantra. And what I learned is, in my absence, yes, it hurt my provider, right? Because they're losing out on a person working, right? That's uh, not a patient. That's a provider or a position that's not being filled. So they lose money because they don't have the staff. You don't have the retention. That staff member's not functioning at the highest capacity. So it's a lose-lose for them. And then it's a lose-lose for you because you're not working or you're having to go to therapy. And it's nothing wrong with going to therapy, but I think people don't want to go to the EAP program is because if people know that I'm suffering, is that going to affect you keeping my job? Am I replaceable now? Right. So a lot of people fear, their job being in jeopardy if people talk about mental health. And so when I talked about I Choose Me, or when people started seeking me out and I coach my clients on this, it's like they were like, Jineen, like, that's the part. That is the part that they struggle with. And I don't think employers really understand the biggest value in making sure that the people that they're not checking in on, that they should be checking in on them. Because when they are not there, they're not functioning, you will miss them.
Yes, and I do want to say my condolences to the people that you've lost.
Yeah.
And thank you for sharing that. And you mentioned drugs. I remember a long time ago, first nursing class was about drug abuse, substance abuse in nursing. I was so confused. Why is this the first class? Why is this the first module? And we're bringing up some of the reasons and how that how we lead to that, in addition to the close access. And maybe I recognize I need to take this PTO. 2 things about PTO. One, well, I can't take it because they're short staffed and I'm not replaceable, so I need to show up or otherwise everything's going to fall apart. And number 2, the PTO isn't, I'm really big on using PTO to help transition your life, change the trajectory of your life. Don't just go sit on a beach and literally do nothing. Which is, I mean, I'm not saying there's nothing wrong with that, but sometimes if you recognize you need to change something in your life, that's a great opportunity to do that, as opposed to just sitting on the beach and coming back in the same situation without a plan moving forward.
I think it's short term, as you said. Like PTO is short term. Like I didn't use it. I mean, at this point, when I finally got the message to myself to use it, but I think where we miss it is the boundaries along the way. It's the little baby steps of you creating, where you don't really like. I ignored the warning signs before I got there. See, most of the time when you taking PTO is because now this is right here. I have to take off versus scheduling it in as if it's an incentive or it's a reward. You should take it. Sit on that beach. Go do something. Go read a book. Go do something with your family. Like, I was excited for the sabbatical. I mean, when I gave the notice, they were like, is there anything we could do to keep you to stay? I said, that'll be a no for me. I'm going to enjoy this time with my child. I'm going to enjoy this time with me. I'm going to step into this new space. Like, that's how I did. They were like, you're just so peaceful. I said, yes, because this is a choice. See, burnout was like, you need to stay home, right? They like, well, you got to stay home. Now it's like, I choose to go home and have several seats and read books and do things I've never did. So when you go back to the first question you asked about what I never got to do, I never really got to be a kid. I've been a nurse since I was 17. I was valedictorian. I push hard. I wanted everything. CCRN, I got all the things.
Wow, this has been a longer journey because even to be valedictorian, that started years before that. Adolescence.
You see what I'm saying? Over time. So for me, when I say I didn't really go away, I stayed because of my family members and just being around people wanting to be the go-to. I became the go-to for my family. You're in healthcare, so you become the go-to when they got every ailment and pain and questions, or you're at the hospital with them to answer questions, right? They would have me there as the liaison to speak on their behalf. So you carry it like a cape. And I got to a point and I said, listen, they'll be okay. But I started boundarying up and understanding that rest, I have permission, right? Because we kind of look for permission. No, you have it. Take it. It's okay.
When we think about our case study, the St. James Medical System, what's one belief about work-life balance in healthcare that you wish they would stop repeating?
I think I would say, so I can say this. I've known two people who took FMLA for mental health, and in a way they were kind of punished or shunned for taking it. So it makes people not want to tend to their mental health or talk about it or suffer in silence. And I wish what they would do is tell them that it's okay to talk about your problems or go to the EAP. But then on the flip side, penalize. It's going to make people not want to do it. But if you do take care of it, meaning like allow them, have respite in some type of capacity, teach nurses or leaders how to encourage their teams to work more effectively without killing themselves in the process. And so when COVID happened, we went on a shortage, right? And people were leaving the bedside, but we had so much influx of patients. So people were really, really working. A lot of people did commit suicide that were in healthcare. We were seeing all over the news, like, this is our time. Like, we never really, like, I worked all during that time. So I look at this as my COVID break off, but like the mental health of all that stress. I mean, I'm in the airway, so I know you got COVID. I'm going to put a tube in there. I'm nervous. We got all types of stuff, and we got families. So like that PTSD, that all those things we hide, they start to surface back up. And I think we never talk about it. They just kind of push you to the next patient. And I think these are the discussion points that leadership never lets us have a pause. And if they would really make more initiatives and speak more about it from a preventative approach and not a Band-Aid. I think we Band-Aid a lot of stuff, and that does not fix the problem. We just put another body in the seat, and then it just happens over and over. And so they're not having retention, right? People are leaving. They're depleted. Why are your good staff leaving? Questions
After all those years after making all that investment. Yeah. You bring up such a good point. I never really thought about COVID when I was going through COVID, but I haven't thought about, we talk about long COVID for the patient, right? But what about long COVID for that medically induced PTSD for the clinician? So when I became a new provider, I recognized anxiety really fast, right? Every time I got an email or a phone, a text, what did I do wrong? What did I miss? Who's upset now, right? Like it was a 10. And then I really started looking back at my own practice, and I was like, I think it's part of our practice. I was like, when I look back, I think it's always there. We just don't talk about it. And so now I was gonna say I was at a 2 for after about the last year, but I would say in the last 60 days, it's gone up, right? And you know what? Some of the things I'm like tapping into now, because I'm tapping into my childhood and my past, but
Hmm.
I completely overlooked COVID. And so right now I have a lot of anxiety, and one of the things I have anxiety about taps into my work. So if I have this thing that's like any day someone could die, right? Like we know life is that fragile, and has created a fear. So it's like if you go and travel and I don't hear from you, what if that's the last time I didn't get a chance to say I love you? I have fear over that, right? And that was a trigger for conversation. We'll call them dialogue.
Yeah, I
Dialogue
understand. Yeah.
in my home, right?
Hmm.
And then I was like, you know what? Look, that's a real thing. That might happen. You might not get to say I love you that last time, but you've been saying it for over a decade. They've been saying it for over a decade. You know they love you. You know they love them. Will you be sad that you didn't get to say it one more time? Absolutely.
Yeah.
But the fear you've been living with that they won't know, you
Hmm.
can let that go.
You can let that go. Hmm.
Yeah.
Hmm.
But the COVID part, yeah, I need to I need to tap into that. Because
We
yeah,
suffered
maybe
in
this
COVID,
is my
right?
first break.
Yeah.
You talk about this is your break. Yeah, this is my first break because I was going through that. I was traveling, I was moving, I was transitioning, moving again, and this is my first break. And yeah, the anxiety it's up there.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
It's not until we sit down, right, that we really have time to process. Like right now, you're processing. I didn't really have words for it then. You don't really know. You're just pushing through, right? Because everybody's suffering, right? Like everybody's moving. So you don't be like, woe is me. I got my problems. Like you just pushing through and trying to make it. But that's one thing with people with anxiety and stuff. Like when they start sitting, that's when all the thoughts and all the things. But, when you really start digging deep, look at the providers who really worked during COVID. Even the firefighters, like it's not just I'm just talking about all of them. A lot of them have some things because we never had a chance to process. We just had to show up, right? And we were nervous and our families were nervous. Like, it was just a lot of intense stress. And your body never forgets about stress. Like I tell people, like stress really took years off my life. To be almost having a stroke before the age of 40, I'm going to be 42. But like those were things that I was like, oh, I'm a healthcare worker, right? So we're the worst patients. They talking to me about things and I'm like, yeah, I do know that, but I'm not doing that, right? We don't be living out the advice. And I got really clear on where my yeses were going. And I was saying yes to a lot. And when you talked about harmony before we move on, I learned that it's about alignment and balance. There's just really no work-life balance. It is really looking at us as a full piece. Like we used to put work with work and this with that, but we're a whole person. And they talk about that in the Wheel of Life. And that's one thing I coach on because I feel like there's different parts of us. Personal development, there's spirituality, there's relationships, there's love relationships, meaning like with your spouse or your kids. Like there's just so many pieces. And when you look at it, it's like, how am I harmonizing for this part of my life? Because you talk about transition. So it's going to look good. It's going to look different every time. And so I had to get comfortable with change because one thing about us, I would say, just speaking in a collateral, when you're overachiever and perfectionist, we like rigid, we like checklists, we like things to be dot of the I and cross of the T. It's very important. I was just talking about that on another nurse podcast. She said, yes, and we color coordinate. I was like, yeah, we color coordinate the checklist. We have to go over it 3 times. We need to circle back and close the loop. Like, it's ingrained.
Yes. And so you talk about kind of like actionable steps. So you created the Bloom framework.
Yes.
Give us a window into what that looks like in practice, especially for tomorrow or leaders trying to turn culture around.
So really my Bloom framework was based upon going from burnout to harmony. And so my book was called I Choose Me, The Intentional Guide to Never Losing Yourself. And so really the B starts for believing in yourself. So you said, where do people start? It is really how you're talking to yourself and your thoughts. And as a mindset coach, you have to know your thoughts lead to feelings that lead to actions that lead to results. And so how are we talking to ourselves? How are we dealing with processing these things, right? We talked about COVID, the thoughts. The love yourself part is where we talk about boundaries and how is your home life, how are your relationships, because if you don't really take care of you, you can't take care of others. And we know that from being with stewardess or air flights, right? They're like, put on your mask, where you put on, we don't function from that way, and that is the point. It flows from your overflow. So if you're not taking care of yourself, you can't take care of others, right? And then the next one, the next O, is own your story. So what role are you playing? What are you looking back on your past? What's going on in your life? And so just looking at, for healthcare leaders, what's going on? What is going on in your department? What's going on in the world? Because most of the time COVID was a world issue, so that wasn't related to the corporation, but how are we pivoting? Jobs are being lost right now, so I'm sure there's a lot going on in the environment based off of that, because that's going to affect how you show up at work, or if you're going to be home, or absenteeism. And then you have the next O, which is overcome overwhelm and self-neglect. You're neglecting yourself. Why? Because you don't have systems, you don't have process, you don't have the boundaries, you don't have the tools. And then the M is you need to master momentum, and you need to master mindfulness. And mindfulness is peace, but also the peace that you have from within to decrease the stress, to go ahead and keep going. And that's why I say baby steps lead to giant leaps. It was when I started baby stepping and showing people that these little things that I was doing, it was causing traction. It helped me look better. It helped my thyroid disease be gone. It helped me turn everything around. Like I had to lose weight. I can take a sabbatical and plan for it. Like it was the baby steps that led over time. So I think if corporations really understand the Bloom framework, and that's what we talk about, I even made a whole coaching program based off my book, because they said, Jineen, we need something. So like most of them are HR leaders. I have an HR leader with me right now. We have a therapist. I have a lawyer. Like these are like high functioning women who are struggling. And so it's big. And when we start talking, most of it talked about their thoughts and what they thought their life was going to be like, or how they're functioning and being in guilt because they're trying to choose themselves, but they feel like they're not showing up enough here or there. And it's just very important, if for corporations, they need to understand that we do need to look at the bigger picture, because if we take care of the people, then your corporation will flourish better. Your talent will stay. Your talent will want to work. They will want to show up. They will be happy. Toxic environments are leading, and as fellow nurses, we know nurses eat their young. They talk about that. And I've been a part of that culture, starting out at 17, running a unit at 17. Do you think those older nurses was ready to see me as the charge nurse? That would be a hard no. Hmm.
I believe that. And yeah, there's 5 million of us, right? So it's a huge issue. And when we talk about nursing school, which I reframed patient care school, because it only teaches us about that one piece, right? And so all these things that you're talking about are super important, but students don't recognize that they don't have those tools, right? They have focus, and not to their fault, right? Every exam, every licensure, every board certification, it just focuses on that one piece. So you think that's the only place where your value lies. And so since you're showing up and using that information, you feel like you're checking all the boxes, but you're only checking one box. One
It's
box.
funny that you say that, because I do teach at a college, but also when you come into the hospital, right? Of course, you do precepting of. So I had nurse anesthesia students with me, and so I started showing them that we're going to go take our break. And some of them have graduated now and reached back out to me and said they've learned not just what's in school, but what's practical tips to help them stay better. One was able to make sure her pregnancy was better, because like I said, I was doing anesthesia, saving a life, and I was losing my twin at the same time. Like that's real, that's deep. And I'm healed from that part, so I can share that from that space. But it's the reality of stress. And I still kept functioning. If it wasn't for the respiratory therapist looking at me like, that's not the patient, Jineen, is that you? And I looked down and my blue scrubs were a mess. You know what I mean? Like this is real life. My son is 9 now. So that was 9 years ago. But I tell people I live it. And when I wrote the book, I brought it back. One of the fellow HR and nursing leaders put it on their LinkedIn. I got 60 books in 1 week based off of these people understanding what it means, how I looked, how I was showing up, but not knowing that really what was going on. So really helping healthcare leaders and helping nurses know that they're not alone in the things that they're feeling and other people see it, and how can we help prevent it. Let's talk to the previous generation, or the upcoming, I should say, with the baton. And I was giving my book to my students for free because I wanted them to know. And so that is something that I think we should be doing as a whole, is giving back.
Mhm. Yeah, and telling students, like, look, while you're in school, it's tough, right? Because 98% of nurses work through school and they have families, they're starting families. It's majority female. They happen to be head of the household, either by choice or or by financially. We've worked with so many of our female peers that are paying for everything. They're sending their kids to college out of pocket. That's why they're picking up all those shifts, right? And then they turn into taking care of their parents too. So we do get how we get there. And I just think we need to do a better job of telling our students, look, if you can't do it while you're in school, we understand it might not be possible. Once you get out, once you get through orientation, these are the things you need to put on your plate that are the next boxes to check. And when you're putting your schedule together, it's not just the shifts you need to show up for that need to go on your calendar. You need to put that therapist appointment on there. You need to put your workout schedule, when you're going to do your meal prep, when you're going to have family time, when you're going to go on a date, when you're going to rest, literally rest. All those things are important. I think we just need to do a better job telling students that and not selling
And
them
at
like, oh,
work,
look how
the things at work, right? Like even when we're there, take that break, take that
yeah.
break, take that PTO, right? You know what I mean?
And people might not understand what we're talking about because the patients always think we're on a break, and that's why we haven't answered their
Their call
call.
bill.
But and it's so hard because you're in your room and you can't see what else is happening, and you're only in your world. But that nurse is not peeing, they're not drinking, if they're eating, it's nothing good.
It became mandatory for me. They knew at 9 o'clock. They said, "Oh, she probably over there in the slot meditating." Like it got to a point. It's a non-negotiable. But I wish that I had known that it was that when I was in their shoes. And so that's why I showed them it's really not a permission thing. It's you have it already. It's just utilize it. And you might think it's nothing now and you have all the energy, but as you get older, your body tells you you're older. And you do need to know what you do now affects your future. Right? We know that with health. If you don't take care of yourself now, it's going to affect you later. And that's the same thing in nursing. Most of them are broken down with ailments and limbs that are crazy because they weren't wearing their support holes. Like it's just so many things you start like learning from the old school now that I'm turning into the old school. But like, yeah.
Yeah, we start to wind down. Let's talk about the business case for investing in compassion fatigue. Why should the C-suite care?
The C-suite should care because even if we relate it to anesthesia, even in healthcare, the operating room is a big money maker. And if your staff is not available, then you don't have staff to take care of your patients. And that means in the ICU, or even if you are a floor nurse, it matters. And even when we had COVID, they were paying buku money to bring in outside help because they didn't even have enough inside help. So that means you matter to the point of they don't want to pay all that money. They want to pay what your basic salary is. They're not trying to pay for all that locum. So their bottom dollar matters. Keeping that talent matters. Showing up for them for magnet. Most hospitals are trying to be magnet and have all the ladders, right? I was on every clinical ladder all the way up to the ladder. The APN ladder and the RN ladder. So I'm saying that's money, right? So that makes them look good when you have all those receipts on your quarterly or your yearly what do they call them now, evaluation. And it allows you to get into other spaces. So people like to be branded. That corporation wants you to be stamped on their resume when you're going somewhere to say that you are top of their creme de la creme. So it matters to them in the end.
And so this is great. I love this because Alicia, my co-host, she's in a leadership, right? And so this question is going to be for her, right? How can she start these conversations in her hospital system if they don't want to hear it?
Ooh. So being the
This is,
change, being the
I'm not
change,
saying her hospital system doesn't want to hear it. I'm just saying someone
if
like Alicia who finds himself in that position, how can she start that conversation?
most of it starts with how you're showing up. A lot of times what I noticed, I had to become the change, but I had to be comfortable with being the change, because when you stand in the front, best believe all spotlight on you, but you can affect your job, or you can affect how you show up. So I think leadership has a better job of making change versus, if I would say, little old me, because it normally comes from head down. And so people watch what you're doing, which gives them permission to feel like, well, if you're doing it in the essence of you're showing it's important to take PTO, you're showing it's importance to have boundaries, you're showing it's importance of work-life balance, however you want to word it, or harmony, it makes the staff feel like you understand and you respect that. And so I would say if she wants to have conversations with more universal peer leaders, then it would be talking about it at leadership meetings. It would be talking to HR itself. How can we make it better? Having wellness retreats, meeting with your staff often, not just to huddle about the patients. You need to huddle about how you doing, because we huddle about a patient in a minute. But let's huddle about how you doing. Let's make sure those schedules look a little bit more effective. Let's make sure your patient care load, because I can tell you about patient care load that didn't look balanced. She got 10, I got 6. Like, let's look at things and check on them strong ones. Check on everybody, but keep your one eye on the strong one, especially if they're not coming forth. And remember, everybody matters, and not everybody feels comfortable coming forth because they don't want to be seen in that regard. So just knowing that there is the ability to take care of everybody, but keep your eye on everybody. Check in often.
Yeah, so once I did start tapping into that anxiety, being aware, me and my mom changed our language. So when we first start talking, we talk every day. When we first start talking, instead of saying, "What are you doing?" or "How are you doing?" we say, "How are you feeling?" And that opens the opportunity to first talk about your feelings, and we have the feelings chart. And then we leave space for you to talk about what's contributing to that. And that's been super helpful. So this is our lightning round.
Yes, go
These
for
are
it.
some quick questions we get through real quick.
Mhm.
Give me 3 signs a clinician needs a sabbatical right now.
Mm. Sabbatical, if you are struggling to go to work, meaning like you just don't have that zeal for it like you used to, you probably need to take a break. If it's affecting your mental peace, you're having health complications, you can't focus, it's lack of clarity, you should take a sabbatical. If you are noticing that your environment is toxic, or where you are, it's just really not for your now, I should say, because you need to move on to something else. Tell yourself it's okay to stop, meaning find a new job. Like, you don't have to stay in dysfunction. Sometimes we stay just to say, I'm not going to let anybody tell me what to do. If it's not working for you, it's not serving you anymore, it's okay to go to something else. And it doesn't mean that they're bad or you're bad. Move on in peace. You said 3
What's
things,
your
right?
go-to? Yeah. What's your go-to self-leadership ritual when you feel yourself unraveling?
Ooh, my go-to. So I told you about the Bloom framework, but the first part is having positive, sexy self-talk. So how you talk to yourself is how you talk to others, okay? And you should talk to yourself like a friend. Brene Brown says that part. And so what I learned is, how am I talking to myself? Have to versus want to. There is a big difference when you talk to yourself and you affirm yourself, because you show up better with more confidence. And most of the time when I tell people I'm helping them beat burnout to have more confidence and harmony, most of the time they want to have confidence in their lives, in their workplace, and how they show up and how they lead. Most of it is how you talking to yourself. Are you saying you're not a good leader? Are you saying you're not enough? Are you saying you're not working hard? Are you saying you, right? So talk sexy to yourself. That's one that I would say. How are you talking to yourself? And then 2, I would say, I told you about my meditation type of ritual that I used to have. I made pockets of time for me. It's a non-negotiable. And I learned where my yes is going. One of my clients is a pharmacist, and she said, Jineen, you taught me how to know where my yeses are going. If you are saying yes to everybody else, you're saying no to yourself. And when you learn how to say yes to what's important and get your word of the year, because that's how you get your, I call that's the compass of the year. So when I say, is it in refinement? Because that's my word. If it's not in alignment, that'll be a no for me. So no in alignment. That'll help you with the boundaries at work, at home, right? Because there's more to you. Using the proper language, as you said, you do with your mom. So using the tools and giving space. As a Superwoman syndrome, we take on other people's problems, even though they may not have asked us. So I don't pick up people's problems unless they need help. You understand? Because we like, let me just help you. That'll be a no for me. Unless you
Yeah.
need me, right? But they need to figure it out, because then you become an enabler.
Yeah. And I think we understand that one real easy, right? And I think when you're giving yourself that permission, giving that sexy positive talk, I love that. That even if you're in a position where it's like, I need help, I'm gonna get help, and that's okay too. Because we have that whole complex of being the strong Black woman, which that's another episode, right? What does that even mean? Because it's okay, crying is still a sign of strength. Admitting you need help is still a sign of
Yeah,
strength.
yeah.
Saying no, setting boundaries, still a sign of strength. So that's a whole nother conversation, right?
Mm-hmm.
So last lightning question: what's one myth about burnout that you wish would retire for good?
Mm. I think I said this earlier, is thinking that we wear burnout like a badge of honor because we think success equals our value and all that. So we're working extra hard and we're doing all those things. I had to learn I was enough in every season. I'm enough at each level, no matter how it is, and giving myself that permission. So the lie is thinking that success equals me losing myself and putting value in that. So that's why I had to learn how to lose my titles and idols and just stand on who Jineen is, because you're more than just that. Those are just pieces of you. And I think we hold on to our success like it's the end all be all. That's why a lot of people struggle, especially when they're in transition, because they hold that weight of that title or that position. And when they no longer have it, that could even be as a wife, that could be as a mother, right? Like when you hold those titles and you don't have them anymore, then you feel like you're not enough. And so the lie is you're enough at each thing, and don't get so wrapped up in them. Learn who you are and what you like and be okay to pivot.
Well, Janine, this has been a very insightful conversation. How can people connect with you, grab your book, and bring in your work to their teams?
Yes. So let's talk about the book. The book is called I Choose Me, The Intentional Guide to Never Losing Yourself Again. We are hundreds of copies sold. We are global. I am grateful for this. This was self-published in February 2024. As I said, I did that from my last bout of bouncing back from burnout and dictated it. And it has been a blessing, which has led to my coaching program, which is called I Choose Me Boot Camp, which is a 90-day program where I teach people how to go from burnout to harmony in 90 days. And we talk about how to beat burnout and overwhelm, how we rebuild confidence and self-love, how we have a personalized roadmap, which then led through my Bloom framework that we want to now go in schools. We want to go into corporations and hospitals, especially as a nurse anesthesiologist in over 25 years of experience. It needs to start prior to it happening. Let's get into a preventative space. So for corporate, I'm a speaker, I'm an author, and I do workshops, and I want to come into there and give them the knowledge that they need to have the resilience training, to know that they're enough, to learn about self-care strategies, and really to help the corporations with the bottom line so they can retain the talent. And most of the talent that leaves, when you look at the statistics, it is 66% of working moms are struggling, 70% of healthcare workers have hit burnout. It's like really real. And a lot of healthcare workers are switching out of hospital settings to go into home or some type of virtual position that is not at the bedside because they have the mental load and they're done. So for me, if we worked on preventative things and you speak from the level of I understand because I lived it. And you
Yeah,
can
actually, I
follow
just
me at all my social media at Jineen R. Huff. Yes.
Oh, wonderful. And we'll have your contact all in the description box. Yeah, we saw that trend. So I just published an article um, talking about the results and the nursing implications of the 2024 Physician APP Provider Incentives Report. And, this is probably something you can use in your thing, because what it shows is that employers are doing a whole lot more to attract new talent than we're doing to keep them. We see this in dating, right? We put on all the fancy stuff when we're trying to get you. And once we've got you, you know,
Not
it's
keeping you,
sweat.
right? So retention is key. Yes.
Yeah.
Hmm.
And we'll have that link in the description box too. We thank you so much for your time. We look forward to seeing what you do next.
Yes.
And
Thank you so much.
yeah, I love the title, I Choose Me. And I think it's a real mind shift, because so much of our clinical training is about choosing someone else and putting them first. And so it is a real mind shift. And so, but you've got the framework to help us get there. We
Listen, we
thank you.
like a good framework and checklist. It just make us feel like we have policy and procedure. We like structure.
Yeah. If this conversation struck a nerve, send this to a leader in your organization or to one nurse friend you know who's always doing fine. If you have any questions, email those to tmi.melanin@gmail.com. If you haven't already, this is your chance to subscribe. Leave a comment, give us a thumbs up. Go over to Apple and Spotify, give us a 5-star review. Let everyone know how informative you found this information, so that the next time someone like you is looking for information like this, will show up higher in their search results. At the time of this recording, we release new videos on Sundays at noon Eastern on YouTube, LinkedIn, and Facebook, and we drop the audio at 5 a.m. so that all my night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.